does it feel for you and all of those working behind the scenes to finally get to this point?
Yeah, thanks, Ashley. It's been an amazing 7 months, and today it culminates in a great achievement to see those first 4 batches leave our facility and become part of Australia's vaccination program.
Could you have imagined at the start of this pandemic that we would get to this point so quickly? I mean, just how unprecedented is this mass vaccination production and rollout? Are you surprised that this is up and running at the speed that it is?
Well, yeah, I would never have believed, 12 months ago, that we would be in the situation here now in CSL where we're actually getting product out the door. We started our conversations with AstraZeneca only a bit over 7 months ago. We kicked off the program, and since then it's been just an enormous amount of work to get to where we are today and actually getting product out the door. It's a real testament to all of the staff here at CSL, to our partners in AstraZeneca, and also the Therapeutic Goods Administration, who've really all worked in partnership to accelerate timelines that would normally take years to achieve what we've achieved today.
The contract is to locally manufacture 50 million doses of that AstraZeneca vaccine. Just how long will it actually take to get that many doses produced? What is the timeline?
Well, we've sent over 800,000 doses out the door already today. There's another 2.5 million doses produced in our cold rooms, just undergoing the final checks. And our intent is to get to well over 1 million doses a week of production within the coming weeks. And I expect we will be able to manufacture the complete 50 million doses towards the end of this year.
You mentioned the final checks that are happening. Explain for us how batch testing works. How much testing is actually done to ensure that each batch and the quality of each batch is really up to scratch?
Yeah, there's an enormous amount of testing that goes in right from the very beginning, where we bring in our raw materials that are used to manufacture the vaccine. Through the process of manufacturing itself, there is a lot of in-process tests that are performed, and then the final finished product undergoes about 15 different chemical and biological tests here in our laboratories and also at laboratories within the Therapeutic Goods in Canberra. And everything has to obviously check out before we're able to allow release of a batch onto out the door.
And then what is that process from there? What happens behind the scenes to get the vaccine from where you are in production to actually getting out to GP clinics right around the country?
Yeah, well, we're just kicking off that process now for the CSL manufactured vaccines, with the first doses being put on DHL trucks late yesterday and this morning. From there, they will be introduced into the network of distribution centres all around the country, and then they will move to the GPs and surgeries all over the country as part of the vaccination rollout.
You've really had a ringside seat looking at how all of this has worked from where to go. What's your message to Australians watching this interview who say, oh, well, it looks like, you know, they've got it under control, it looks like they know what they're doing, but I'm hearing all these reports from overseas that are making me question whether or not I want to go ahead with actually getting this jab in my arm?
Yeah, well, I think the message that I would give is that we've seen tens of millions of doses of the AstraZeneca rolled out in countries already around the world. I think over 17 million doses in the UK alone have been given to people, and you know, the health benefits of taking the vaccine just can't be overstated in the environment we're in with the global pandemic.